All attendees are in listen-only mode.
Hello, everyone. Thank you so much for attending our event here on the Associate's Degree of Nursing. We really are excited and happy to bring information about this wonderful program to all of you. And again, we do appreciate you taking time out of your evening to be a part of this presentation that we have to offer you. And I'm going to introduce some very important people related to this program here in just a second. But real quick, I just want all of you to know that during this presentation, at the end of the presentation, there will be time to answer any questions that you might have. If you have any questions at all during the presentation and after, you'll see a little question box that you should be able to click on and type in whatever questions that you have or that come up during the presentation. And at the end of the presentation, we'll be more than happy to go through those questions and answer all of them with you. So without further ado, I will get started by introducing some wonderful people that are involved in this great program that we have to offer you here at Bay Path University. First and foremost, my name is John Alonzo. Again, welcome. I am the Senior Director for Admissions for Bay Path Online, which is the online division of Bay Path University, which is where the Associate's Degree in Nursing resides. And I want to introduce you to, again, a group of very important people associated with this program. First and foremost is the program director, Dr. Linda Adams-Windling. We call her Dr. Linda, who is here today. I want to say hello to everybody, Dr. Linda.
Good evening. Look forward to visiting with all of you.
Thank you very much. And Dr. Linda, I know she's not here today, but if you wouldn't mind introducing your colleague who is not here today, but we certainly want to recognize her as a part of this program.
Absolutely. Jamie Robillard is our pre-licensure Associates of Science in Nursing track coordinator, and so she will also work very closely with those of you coming into our program.
Wonderful. Thank you so much. And then now I'll introduce everyone to our interim assistant director of admissions and who also works with the ASN students, Shayna Dulac. We call her Shay. So you want to introduce yourself, Shay?
Hi, welcome everyone. We're very excited to have you here.
Excellent. And last but certainly not least is our senior director, our senior admissions counselor, I should say, for the Associate of Science and Nursing program, Megan Clary. Megan, say hello to everybody.
Hi, everyone.
Wonderful. Thank you all so much for being here. And I will hand this off to Megan, who will start us off.
I believe it will actually be going off to Shay.
Oh, I'm sorry. My apologies. I screwed up already. It goes to Shay first. You're right. I'm looking at my agenda. I was looking at the wrong line. My apologies. I will hand it off to my interim assistant director of admissions, Shay. Thank you.
No worries. So tonight, guys, we are going to go over a lot of information, a little bit about Bay Path University, the admissions requirements for the Associates of Science and Nursing program, do a quick little program overview, address the next steps, and of course, have that time for you to ask questions. So at Bay Path, every learner's dream of a better career, a richer life, and a brighter future will be realized. That is part of Bay Path's mission. And as you can see from the photo, that is one of our graduating years. So it's actually really exciting to see that in this slide. So why Bay Path? For this program and for a lot of our other programs, we do not have prerequisites required. We do require a high school diploma or equivalent with a 2.0 GPA. The coursework is fully online. With this program, the hands-on nursing skill labs and practicums will be held routinely. I know that Dr. Linda is going to talk a little bit more about that. Transfer credit is considered, and again, that is something that Dr. Linda will address later on. You can graduate in about 2 years or so. It just depends on how many classes you take. And there's pathways to continue your education, like the Bachelor of Science, the RN to BSN program. And we are competitively priced at about $700 per credit hour. And next, I'm passing this on to Megan.
Thanks, Shay. So obviously we are going to be discussing the Associate of Science and Nursing program. This is consistent with the nursing education mission, vision, and values. The Bay Path ASN program provides high quality education for a diverse community of professionals. The program prepares associate degree in nursing graduates to make a significant impact on health through entry-level preparation, successfully completing the National Council Licensure Exam for Registered Nurses, also known as NCLEX, and begin practice as a registered nurse. This program is 70 credit hours. It is broken up into 6 semesters, and we do have a 2-step admissions process, which we will be discussing further. So step 1 of the admissions process, this is actually the process that you all will be doing with either myself or Shay. In this portion, you would have to meet the university requirements. For us, that would be either a high school transcript or GED equivalent, a minimum of a GPA of at least 2.0. You do need 2 letters of recommendation during this first part of the admissions process, and any official college transcripts. If you attended multiple institutions, we would want to take a look at all of those transcripts. By the time you get to the second part, you will see that all of what I have mentioned is already listed. You will also need an admissions essay, and then the NCSBN functional abilities and clinical agency requirements as well. And then I believe I will be passing this off to Dr. Linda.
Thank you so very much. And this evening, we're going to just take a little bit of a journey through the Associates of Science in Nursing curriculum to give you all just a little bit of an idea of this 70 credit hour program and what is incorporated into the program. So the plan of study that we're looking at this evening is based on full-time study, but I do want to preface that if your journey is best going through a program such as this on a part-time basis, that is also an acceptable trajectory as far as moving through our Associates of Science in Nursing program. So the first semester of our program, and again, I just want to reinforce, there are no prerequisites for this program. There are also no admission tests that one needs to take in order to come into this program. So again, if you meet the admission criteria, obviously, then you are qualified for evaluation for admission to the program. During the first semester, we generally will have students involved in coursework such as anatomy and physiology. And this course has an online lab, so there's no, how do I say, face-to-face component. It's totally online. And you'll notice that this course is a NUR course. So this is a little bit different than other anatomy and physiology courses because it's an applied science and applies nursing practice. Our nutrition course is also routinely provided in this semester. And you will also notice that this is an NUR course. So again, this is an applied nutrition course. So different than potentially a biology nutrition course or a biology anatomy and physiology course. Additionally, in this semester routinely, we would have you take an English course as well as an intro to psychology course. In the second semester then, you're building on that first semester. And you can see that we have another NUR science course, microbiology. Again, when you see with lab in these courses, those labs are online. Additionally, in the semester, routinely, you would take a human growth and development course, another English course, and again, we begin to introduce the practice of nursing by the second semester through our Concepts in Nursing course. While you move through the ASN program, as you move into the third semester, that's where I call technically what is known as the real meat and potatoes, one could say, of the nursing program itself. So you'll have Foundations of Nursing. Now, Foundations of Nursing is a 6-credit-hour course. So approximately 3 credits are allocated to what is known as online didactic learning, and 3 credits are allocated to your lab, where you will learn actual hands-on basic skills of nursing, such as how do I give an injection? How do I ambulate a patient or walk a patient? How do I assist a patient with a walker? How do I assist a patient in elimination and learning how to put in catheters or assist them in their overall hygiene, dressing, grooming? So this is really where foundations of practice in nursing practice occur. Routinely, this lab is a seminar type of lab where students come into the Ryan Center in East Longmeadow and complete the lab face-to-face over 4 or 5 weekend seminar sessions. As we get into health assessment in this same semester, we're learning about the basics of how to evaluate a patient. So you're learning how to take a history and do a complete physical exam. This course also includes a lab. Students routinely come in once or twice over the semester to complete the competencies of health assessment. And then we also routinely include pathophysiology in this semester, where you're learning the abnormals in relationship to the normal function of the human body. As we move into the 4th semester, this is where you begin really immersing in the different areas of nursing practice, learning how through adult health to take care of the adult client, including the elderly. In the adult health practicum, you will routinely again be in the clinical setting. This will involve routinely about 12 hours per week over a 14-week session. You will also have a care of the family course where you learn how to take care of individuals, women who are having a baby. Additionally, you will learn how to take care of pediatric patients or children, and you will have a practicum, again averaging around 12 hours per week over a 14-week period. As you move into the 5th semester, you will again be expanding into different specialty areas, behavioral health, as well as critical care or complex care patients. Again, you will average in your practicum approximately 12 hours per week over a 14-week period. Additionally, in that semester is where we have pharmacology, but pharmacology, pathophysiology, again, many times can be taken in several different semesters. And then the exciting semester, the very exciting semester, I should say, is your 6th semester, where you enter into what is known as a capstone practicum. You will be aligned with another registered nurse in a healthcare organization, and you will work with that preceptor over that 14-week period, again, averaging approximately 12 to 16 hours per week in that capstone practicum. Additionally, in this semester, you learn leadership and management skills. Again, the leadership and management skills are so essential to a registered nurse. Once you become licensed and you are employed in a healthcare organization, you will then be leading the healthcare team. In this semester also, we provide a role transition course and strategies for NCLEX success. So incorporated into this course is a review course to prepare you for your licensure exam or the NCLEX RN exam. The structure of this curriculum is what we call a modular format. So over a 14 to 15 week period, each week a new module opens for each of these different courses. You will have different kinds of assignments, whether they be discussions where you're immersed with your colleagues, different assignments, and we use specific assignments by Assessment Technology Institute so that you are immersed in the kinds of questions throughout your different assignments that you will be faced with when you sit for the NCLEX licensure exam, as well as that critical thinking and clinical judgment that you will use as a registered nurse when you enter practice. And each week we routinely have a quiz. You will also have a midterm and a final. So that gives you a little bit of an overview of the types of coursework you would have associated with this curriculum, as well as the overall structure of the curriculum, as well as the time frame of the curriculum. So thank you. We're just going to take a few minutes and again, just reinforce what you've heard earlier, that once you complete the 6 semesters full-time for the Associates of Science in Nursing, or if you go part-time a little bit longer, that you can continue your education at Bay Path University. It is essential that should you want to continue in your career development as a registered nurse after completing your associate's degree and attaining licensure as a registered nurse, that you attain your Bachelor of Science in Nursing. And this type of program is available at Bay Path University, known as our RN to BSN program. And within approximately 12 months, you would be able to complete your Bachelor of Science in Nursing. We also have a Master of Science in Nursing program, which is a 2-year program for most individuals, where you can attain competencies to be a nurse educator and a nurse administrator, because this particular degree is a blended degree. And we also have a Doctorate of Nursing Practice program. So if you have a master's degree in nursing, you can complete your doctorate in our postmaster's program, or if you have your bachelor's degree in nursing, you can enter our Family Nurse Practitioner program and move from a bachelor's degree in nursing to a family nurse practitioner. So these are all of the pathways that you can begin to complete upon completion of your Associates of Science in Nursing. One of the things that's very important for you to know is that once you are admitted to a nursing program here at Bay Path University, you would not have to reapply in order to continue your pathways. And now we'll turn it back to the team.
Thank you, Dr. Linda. We will go back to speaking about the application process as we briefly mentioned before. Like I had said, the application is a two-step process. The first part of the application process is the Bay Path University application. That will remain open until June 16th. You would have to make sure that your application is completed by that date. And then 2 weeks after that would be the nursing application deadline, which is June 30th. As I mentioned before, during the BPU application process, that would be for conditional acceptance into the school. You would complete an application online, which is a free application with us through our website. That is where we will collect your official transcript. So that would be your official high school and college transcript or transcripts if you had attended multiple schools, and your 2 letters of recommendation. Once we receive all of those documents, Shayna and myself would review, which we're currently going through, many applications to make sure everyone has all of their documents. We would then be conditionally accepting folks that can move on to the second part of the application process. You would then be sent the nursing application after conditional acceptance, and that is emailed directly to you. And then everyone would be notified as far as decisions of acceptance by August 1st.
Thank you, Megan and everyone. So I just want to provide real quick some contact information. So for Dr. Linda, she can be reached at lwindling@baypath.edu. And then her colleague, Jamie Robillard, is jrobillard@baypath.edu. And then to contact admissions directly, you would email undergraduateonline@baypath.edu, or you can utilize the main number 413-565-1700. All of this contact information is on our website as well, and the admissions contact information is on the ASN program page as well of our website. So, having said that, we are at the end of our initial presentation. So, I want to go to any questions that might have come up, and I do see some have popped up here. This first question is from Ruth. Hello, Ruth. Thank you for joining us. And it says, with the ASN, if you already have some transfer credit, will it still take 2 years? That's a great question. Dr. Linda, would you like to discuss transfer credit availability for this program?
Absolutely, and that is an outstanding question. Routinely, students coming into this program very commonly, if they have attended different colleges or universities, will transfer in their English and their psychology courses. As far as the NUR courses that I discussed, we would look at those courses if admitted, but I would need a syllabus and a little more detail just to make sure those were applied courses. But we definitely would take a look at any potential transfer credits.
And would that affect the time frame of the program based on the credits that you would accept, Dr. Linda?
Oh, absolutely, absolutely. Again, historically, if students have transferred in, let's say, the English and the psychology courses, obviously that equates to about a full semester. So again, we adjust the plan of study for the students based on, or the applicants based on any transfer credits. Absolutely.
Perfect. Thank you. Next question is from Natasha Lewis. What option do you offer for LPN to RN? We don't have a specific LPN to RN program, but I do know that you do review LPN credentials, Dr. Linda. Is that correct?
It is. And we have what is known as an advanced placement process for LPNs. So the way that works is once an LPN is admitted to the program, then we evaluate the competencies of the LPN by providing them what we call an advanced placement exam, which includes taking a online exam and then demonstrating skills specific to the first year of the program. If the individual scores at the level of competency required and outlined in our policies, then the individual would have just 1 year routinely left to complete the program and be able to sit for the national licensure exam as a registered nurse.
Wonderful. Thank you. And the next question is from uh, Maradalin. I'm probably screwing up your name, and I hugely apologize, Maradalin. Please forgive me if I did mess up your name, but it says, hello to you. If I have completed anatomy and physiology 1 and 2 with labs, microbiology with lab, uh, pathophysiology, fundamentals of nursing, intro to nursing practice, and other nursing prerequisites, are they transferable? I believe you already touched upon this already a little bit, Dr. Linda, but would you like just to reiterate that a bit?
Yes, I'm happy to. Again, any of the NUR courses, we are happy to take a look at those, but we would definitely need the syllabus and some additional information to make sure that those have been incorporating all of the necessary information that we believe is necessary in order for you to be successful with the national licensure exam as a registered nurse. Again, there's a certain amount of what we call residency hours that have to be completed at Bay Path University to complete the degree, so we take a look at those as far as numbers of credits that could actually transfer in. But we would definitely take a look at all of that and individualize a plan of study for you.
Wonderful, thank you. And I believe this question probably already got answered, but interested in the LPN advanced placement. What is the test required and scores needed? I believe you already covered that. I don't think you went over specific score, um, uh, the actual score levels, but the point was an advanced test would be submitted to those specific students where that would apply, and as long as they meet the that level of requirement, then they would be able to have those um, to have those credentials uh, awarded. Correct.
That's correct. And I can expand on that just a little bit more. As outlined in our published policy, we use Assessment Technology Institute. And so the exam that individuals would take would be the Fundamentals Content Mastery exam. And we require a proficiency level of level 2 because that shares with us and lets us know that the individual has the competencies, although practicing as an LPN is really with their experience, has the knowledge, skills, and attitudes at the level of the registered nurse for those foundational courses. That exam, again, is not administered until the individual is admitted to the program. Again, there is a psychomotor component to that, where after level 2 is attained, then the individuals also would demonstrate the actual psychomotor, or what I call the application and touching of patients, demonstrated necessary for the foundational courses in our first year of our program. Hopefully that answers the question in more detail.
Wonderful. Thank you so much for that, Dr. Linda. Next question. This is more an admissions question. Does BayPath accept Sophia learning credits? We do have posted on our website and on our catalog all credits related to external sources that we are able to accept. Off the top of my head, I don't recall if Sophia is listed. Megan or Shay, I don't know if either one of you know off the top of your head if Sophia learning credits are included as a part of those external credits that we accept. So please jump in if you know off the top of your head.
We do accept Sophia credits for those 2 English courses and the 2 psychology courses. So the critical reading and response, the research and writing in the disciplines, and then introduction to psychology and growth and development.
Perfect. Thank you for answering and confirming that. I much appreciate it. All right. Next question is from Mariana. Hello, Mariana. Hi, I have submitted all of my documentation and credits. What would be my next step? Wonderful. So, Mariana, if you are working with either Megan or Shay at this point, if they haven't done so already, they will be reviewing all of the received documentation we need for step 1. And then once you are conditionally accepted, you will be sent an email with the next step of that admissions process, which is the link to the nursing application, where you would complete the nursing application, and and that's where you would actually submit your essay and all of the other remaining credentials needed to submit. And then once you've done both, you've been conditionally accepted, and you've submitted your nursing application. Then again, there is a bit of a time to wait. Official notifications on acceptances into the program will go out on August 1st. So I will make sure that either Megan or Shay, whoever is working with you specifically, connects with you just to verify that we have everything we need to either move you to step 2, or just to verify that we have both conditional acceptance and the nursing application on file for you. And then you should be all set until final decisions are made in August. All right. Going on. Wonderful questions. Let's see. This next question. This is from Camille. Hello, Camille. Coming in with LPN, where would I pick up the coursework plan? Not sure I fully understand the question. My apologies. I think in general, again, I'll defer to you, Dr. Linda, but I would, if an LPN is accepted into the nursing program and they've gone through all of the LPN advancement procedures to meet that criteria, then you would work. You and your team would work with those students on their schedules and their plan of study. Is that correct, Dr. Linda?
That's correct. And more explicitly, the answer to the question is if the LPN entering the program, again, meets the competencies through the evaluation process for advanced placement, then basically they would start in year 2 of our published plan of study curriculum.
Wonderful. Thank you so much for that. The next question is from Tabitha. Hello, Tabitha. Hello, my name is Tabitha, and I was recently waitlisted, and I was wondering if I would need to resubmit anything additionally aside from resubmitting the application. No, the new app is the new nursing app is all that we require. So if you've been waitlisted from the last term, and as long as you've connected with admissions to have your application moved to the next term, which would be this fall, um, then and you've had the link for the nursing app for fall sent to you and resubmitted, then that's all you need to do. So Tabitha, again, we will. I'll make sure that Megan or Shay connect with you just to verify we have everything we need for you to be reconsidered for the upcoming term. Um, all right. Next question. Here we go. This is from Rosio. Hello, Rosio. I was accepted and placed on the waiting list for the spring term, and I would like to request that my application be considered for fall term instead. Could you please let me know if I need to resubmit any documents, including letters of recommendation, or if my current application will remain active? I have already completed the anatomy, microbiology, physiology, and nutrition, and I'm very committed to beginning the program this fall. I would also appreciate any information regarding my chances of admission for the fall semester. Wonderful. Thank you so much, Rosio. I will make sure that we connect with you to make so that we can move your application from spring to fall. But don't wait for me if you don't. If you go to the undergraduate online at baypath.edu, you can just email directly and let them know that you want to have your application moved for consideration for fall, and then we will just do it for you. But I will also make sure that we reach out to you as well. Again, once we move your application from spring to fall, the only thing you will need to do is you will be resent the nursing application link. Just resubmit that the nursing application, and then we will be all set for reconsideration. Thank you for that, Rosio. All right, moving along here. How do the online classes work? Are they scheduled or self-led? Great question. I will answer generally, and then I'm going to move it on to Dr. Linda, who can be more specific because there are some nuances to some of the courses I know. But in general, these courses are asynchronous in nature. I will say many of the courses are going to be asynchronous in nature, which means that you'll have the ability to log in at any time, day or night. You have access to your course 24 hours a day. But there are weekly deadlines. So even though you aren't required to log in to a course at a specific day or time, there are deadlines for discussions and for the assignments that you will have to meet each week. So just make sure that you are meeting those weekly deadlines in those asynchronous courses. But when you log in to do your work is completely based on your schedule, and that's what makes an online program so flexible. Is to be able to have that kind of access. But Dr. Linda, I'm sure there are going to be certain courses where there might be some time requirements, and so I want to make sure that you hop in to help answer that question as well.
Thank you, John. Overall, you did an excellent job, so thank you. The courses, again, in this program have what we call a hybrid presentation. And what that means is that the courses are structured in modules over 14 to 15 weeks. Each week, routinely, as shared earlier, there are assignments and there are due dates. Routinely, there is parts of assignments due on Wednesdays and parts of assignments due on Sundays. So you have a lot of flexibility, because one of the things we wanted to do with this didactic or theory component is make sure that you had a lot of flexibility with this program, so that it was an accessible type of program. The face-to-face component of this program obviously are the labs that I discussed earlier with the curriculum, as well as obviously the clinical practicums, which are essential for this type of a program. Again, we've tried to cluster those basically one day a week or in seminar format, as I shared earlier, to make the actual curriculum very flexible. Faculty are available. It is amazing, because we know students are working on their assignments at all times of the day and night, and our faculty are absolutely phenomenal in getting back to students very quickly if they have any questions. Courses routinely have presentations by the faculty or supplemental information, so that information is reviewed. One of the things that's really nice about this program also, all of the resources are open access resources or open educational resources, or provided through our application of what I mentioned earlier, Assessment Technology Institute. And so that's one of the other perks of this program. There's not a lot of textbook expense associated with the program. So hopefully that helps to answer a little more the question.
Thank you very much for that, Dr. Linda. I'm trying to get through these questions as quickly as I can. I apologize. I know that we still have about 20 minutes left, so hopefully we can get through all of these. But I do know that there are a lot, and I really appreciate all the questions. But if for any reason we do run out of time and people have to go, um, if your question was not answered, please connect with admissions directly at the undergraduate online at baypath.edu, and we can absolutely connect with you to answer your questions. Or if you're already working with Shay or Megan, please connect with Shay or Megan directly, and they can certainly help answer your questions as well. So I just want to throw that out there before time runs out for people. This is from Christian. Hello, Christian. Is there a summer admission? Unfortunately, there is not. The program does run twice a year. We have a fall cohort and then a spring cohort. So fall is the next available term, and then after that would be the following spring term. Tiffany, hello, Tiffany. Tiffany's question. Hello, will I need my high school diploma if my college transcript has been sent over? Also, I have a bachelor's in psychology. Would I need to retake the psych classes? We would certainly do a credit evaluation for your psychology courses to make sure to see if obviously any of those general education courses would fit the curriculum for this program. For conditional acceptance, if you have a bachelor's degree, you would not need high school transcripts to be conditionally accepted, but for the nursing application and to be considered for the nursing program, we would need proof of high school graduation. So that could be a copy of your diploma or something that shows that you graduated high school in some official capacity. So it doesn't have to be an official high school transcript. That's typically the best way of providing it, but it's not necessarily required for step one of conditional acceptance because you have already earned a bachelor's degree. But you would have to provide some proof of high school graduation to be considered for this program. Dr. Linda, am I correct with that?
That's correct. And that's a requirement for licensure. So I think that's the other point that's really important when we talk about the high school transcript or the high school diploma. Also, I would like to share individuals who have a bachelor's degree in another discipline. You may actually want to look at what's known as our direct entry Master of Science in Nursing program. This program is a program where individuals who have already received a bachelor's degree can enter the program and complete all of the pre-licensure requirements to sit for NCLEX and become a registered nurse, and then continue and finish with a Master of Science in Nursing and enter the profession with a master's degree. So again, it's just something to think about.
Thank you very much for that. I am going to bypass some questions that I know we have answered, just for time constraints purposes. But again, if you submitted a question that you feel you didn't get an answer to, please certainly email us directly, and we will absolutely answer that question for you. Okay, where am I? So next. This is from Leah. Hello, Leah. I've already started my nursing application and was unable to download a letter of reference form to my second person. How can I fix this? We should be
John,
able
I
to.
can take that one for you. Leah, I will send you the form directly.
Awesome. Thank you. Love that. Teamwork makes the dream work. All right. Thank you very much. And then let's see. Next one. Here we go. This is from Clarisse. Hope I'm not destroying your name. Also, might have already missed this, but do I have to reapply if I already did conditional acceptance once this year? If you are waitlisted, we can move your application. You would have to resubmit the nursing application for fall, but everything else would carry over. That would be the only other thing you would need to submit. So just for clarity purposes for that. If you have not connected with admissions to have your previous conditionally accepted application moved to fall yet, please connect with admissions at undergraduateonline@baypath.edu, and we will absolutely do that for you. And then make sure that you're all set for fall. Okay, so moving along, I'm trying to be as quick as I can. My apologies. This question is related to anatomy and physiology 1 and 2 taken through straighter line. Again, Shay and Megan, straighter line we can't accept, correct?
For the English and psychology courses, we definitely can. Anything outside of that would be for Dr. Linda.
Got it. Dr. Linda, do you happen to know if you would accept credits taken through straighter line?
Again, as shared, any courses that are NUR courses, we would look at after individuals are admitted to the program, and they would need to submit the syllabus and the content of the course, so I could take a look at it to see that it is an applied science course.
Got it. Thank you. Yeah. So I guess the best answer to that question is submit your transcripts from straighter line, and we will have them reviewed, and hopefully determine if they can be accepted or not. Again, a question about recommendation forms. Please, you can either email Megan or Shay directly if you're already working with them, or if not, just email the general undergraduateonline@baypath.edu, and we'll be able to help you out if you need help with getting the recommendation forms. This is a good question. How many days per week are we expected to be on campus once we get into the program? Would you be able to elaborate just a little bit more detail on that, Dr. Linda?
I'm happy to. Again, with this curriculum that we went through, routinely individuals would not be coming to campus until their Foundations of Nursing course and their assessment course, which is basically in the third semester, depending upon, again, if you transfer in credits. And the Foundations lab, as shared earlier, is in a seminar format. So routinely that includes 4 to 5 weekends or 2-day seminar sessions throughout that semester. Health assessment twice. And so again, the health assessment online because routinely, or the health assessment on ground, excuse me, because that's in the same semester. We try to coordinate that around the Foundations lab time. And then as you get into the practicum courses, starting routinely in the 4th semester, then you're not coming to campus. You are going to your clinical site on average 12 hours per week.
Wonderful. Thank you for clarifying that as well. All right. I'm just trying to gloss over questions that I know we've answered. Are exams online or in person on campus? The online courses do online exams. And I don't know if there are any exams that are required to be at an on-site location. Dr. Linda, would you be able to clarify that?
Again, the didactic or the theory exams are online. We do use Lockdown Browser and we do proctor certain exams, which means they're online, but there would be a proctor present with you. Again, you're online, the proctor's online, so it's not like you have to go anywhere. And you can take those exams in your, in the comfort of your own home. We do have psychomotor or skills exams, and obviously you would be physically present with the instructor when those occur.
Got it. Thank you. This question, can you provide how the schedule will be if we are coming in for practicum? Would you? That's a good question. If you can, Dr. Linda, can you discuss a little bit about how practicums are managed?
Absolutely. I think that's a very appropriate question. So what's the agenda for the day? So let's first break this up into lab and practicum because they're in 2 different environments. So routinely the lab starts at 7 in the morning and goes until 7 in the evening. Routinely those are 2 days back to back over 4 to 5 different seminar sessions. The practicum, you would arrive at the clinical site, whether that be a hospital or a clinic. You will arrive somewhere between 6 a.m. and 7 a.m., depending upon that particular clinical site, and you will be there for a 12-hour period, on average 1 day a week.
Thank you.
And that is a great introduction to the practice of nursing.
Wonderful. Thank you so much for that. How important is it that the letters of recommendation are from healthcare professionals? Dr. Linda?
That's not important at all. Basically, you're going to reach out to someone that knows you, that can give an overview of you in a work setting specifically. That's what we're looking for.
Great. So it doesn't specifically have to be from a healthcare professional per se.
No.
Wonderful. Thank you for clarifying that. That was a good question and a clarifying question. Appreciate that. Thank you. So again, that's a question we had answered. There are a lot of questions related to the LPN process, and so I think we've gone over that quite a bit. If any of you came in late, and maybe something wasn't covered, and maybe you're just coming in here at the tail end, I will let everybody know that this session is being recorded and it will be available later on our website. So if anybody wants to go back and review this presentation and the Q&A afterwards as well, all of it is being recorded, and so it will be available on our website very soon after this session this evening. Financial aid question: does BayPath have lots of financial aid or other ways to help with funds? Always a great question when people ask about funding, because I know it's important. Financial aid is available for qualified students, so you would be able to work specifically with a dedicated student finance representative to help you in determining the best way of funding your education with us. For those of you that are planning on using financial aid, that does start with filling out the FAFSA, and you will be provided information and resources to help guide you through that if you've never done it before. But the FAFSA results will be what determines how to best fund your education through that route. If you are currently working or currently employed and you have an employer who offers tuition assistance benefits, we highly encourage you to reach out to your benefits supervisor or your HR representative that can provide that information for you as well to determine what the viability is in utilizing any tuition assistance benefits that your employer may be able to provide to help you as well. The institution does have scholarships. Those are also managed through the finance department. So when you're working with your student finance representative through your funding plan, you will have an opportunity to discuss all available scholarship options and how to apply for those as well. So we do offer a variety of different options to help support students with funding their education. And of course, as I said earlier, if you are employed and the employer has an opportunity for you to utilize any tuition assistance benefits, highly encourage you to look into that as well. Great question with regards to funding. Always important, I know. I know we're coming on the last 2 minutes, and again, I so apologize if there were questions that I didn't get to yet. Can we get a copy of the recorded presentation? Yeah, as I just stated, thank you for that question. Yes, this recording will be available on the ASN program page of our website by early next week at the latest. So we are gonna make sure that this gets made available for everyone. So yes, absolutely. We just talked about the clinical sites, so thank you. That question was answered. Math mediation exam will be at the clinical site or online. Could you clarify that, Dr. Linda?
again, I'm not quite sure I understand the question. Do you want to say that again, John?
The question said math mediation exam will be at the clinic site or online.
Okay, we have what we call a dosage and calculation medication administration exam. We routinely give that as a proctored exam online. If individuals have to take it more than once, obviously we do remediation before that second testing.
Um, Thank you for that. And I know this was discussed because I have seen this question come up again multiple times with regards to the practicum. This person specifically lives out of state, and they're asking, will there be availability to do practicums in their local area? And I believe that the answer is yes. We try to support students wherever they are with their practicums. Is that correct, Dr. Linda?
That's correct. Again, if you're admitted to the program, obviously we would ensure that we have adequate placements for you in your reasonable geographic area.
Wonderful. Just I thank you for reiterating that. I know that is a question for a number of our applicants and individuals who are here today who might be out of area. We are at our time, and I do apologize that if we haven't gotten through any specific questions that you may have had that we didn't answer. I was sifting through the questions as fast as I could to go through. I feel like there were a number that were repeatable questions, so I think we did answer them. But please, I encourage all of you again, if you didn't hear your question answered, or at least answered in a way that that fully answered your question, please either connect with Megan or Shay directly, or the undergraduate online at baypath.edu. We are more than happy to make sure that all of your questions are answered. That's what we're here to do, and we're here to help you and support you. I do want to thank all of you for being here. This was, we're always excited to be able to work with prospective students on a program like this that we know is always, it's highly valuable. Highly, I won't say valuable. That's not the right word. It's an important program for a lot of reasons. And we appreciate just seeing the number of individuals out there who are really invested in this type of earning this type of a degree that you can then take to your own communities and start supporting those people within your own communities with a degree like this. That's why we're here. So again, we want to thank you so much for being a part of this. Thank you, Dr. Linda, for all of your expertise in this program and leading such a wonderful degree for BayPath. And thank you, Megan and Shay, for helping and supporting these students as they work towards hopefully getting an acceptance letter in August. Any final last words, Dr. Linda?
I just want to say thank you for joining us this evening, and we are hopeful that you will apply if you have not, or if you have applied, we look forward to reviewing your application.
Thank you. And Shay, any final last words?
We're very excited that you have all applied, and we're very excited to assist you. It is a lot of students, so it may take us a few days to get to you, but we will get to you. Don't worry. Our information is available online, so please email us if you need anything right away.
Thank you. And Megan.
Couldn't have said it better myself, Shay. Thank you, everyone.
Again, thank you all very much. We appreciate it. Recording will be up by next week, so anybody who wants to come back and review this session, you will be able to do so. Have a wonderful evening, everyone. And again, we hope to work with all of you and support you in your educational goals in the future. Thank you very much and have a great evening.